Welcome to our comprehensive guide on acute cholecystitis, a condition affecting thousands of patients annually. We'll explore the essential aspects of gallbladder inflammation, from its underlying causes to the latest treatment approaches. This topic is based on an article written by Dr. Rajarshi Mitra, a laparoscopic surgeon and proctologist practicing in Abu Dhabi, UAE, and will provide medical professionals and patients with vital insights into understanding and managing this condition effectively. The gallbladder plays a fascinating role in our digestive system. This small, pear-shaped organ beneath the liver stores and concentrates bile, which is critical for digesting fatty foods. When we eat, the gallbladder releases this concentrated bile into the small intestine. Should this system become blocked or obstructed, it can lead to a painful inflammatory condition called acute cholecystitis. Acute cholecystitis is a severe gallbladder inflammation that demands immediate medical attention, affecting 10 to 20% of adults with gallstones in developed nations. While acute cases appear suddenly with intense pain, nausea, and fever, chronic cases develop gradually with milder symptoms. Here's the crucial difference. Acute cases can quickly become serious if untreated, while chronic cases slowly damage the gallbladder over time. The primary trigger for acute cholecystitis is fascinating: gallstones blocking the cystic duct. These hardened bile particles, containing cholesterol and bilirubin, can range from tiny grains to large masses. When a gallstone obstructs the gallbladder's drainage passage, it creates a dangerous chain reaction. The blockage traps bile, building pressure and inflaming the gallbladder walls, resulting in the severe pain and swelling that characterizes this condition. You might be surprised to learn that gallbladder inflammation isn't always caused by gallstones. A less common but potentially more serious form can occur in critically ill patients. Key factors include reduced blood flow during shock, extended fasting or IV nutrition, major trauma or surgery, and certain viral infections like cytomegalovirus. This condition requires especially close monitoring and quick medical intervention. Who's most at risk for developing this condition? Age and gender play significant roles. Your risk naturally increases with age, and women face higher risks due to hormonal factors in pregnancies. Weight and diet are also crucial. Obesity and high-fat, low-fiber diets can substantially raise your risk. Additionally, certain medical conditions like diabetes and high cholesterol, along with a family history of gallbladder disease, can predispose you to problems. Rapid weight loss and some medications can also trigger complications. When acute cholecystitis strikes, the symptoms are hard to ignore. They typically appear suddenly and can be quite severe. Sharp, constant pain in the upper right or middle abdomen may radiate to the right shoulder blade, worsening with deep breaths and lasting for hours or days. Nausea and vomiting frequently occur alongside the pain. If fever and chills develop, that's a sign the inflammation is progressing to infection, requiring prompt medical attention. When should you seek immediate medical help? While some symptoms can be monitored at home, there are clear warning signs that require urgent care. If you experience severe abdominal pain, especially when combined with nausea and vomiting, don't wait to seek help. Pay particular attention to the development of jaundice, that yellowing of skin and eyes, as it could indicate a blocked bile duct. When the abdomen becomes notably tender to touch, what we call a positive Murphy's sign, that's another red flag. Remember, early diagnosis and treatment are essential to prevent serious complications from developing. Accurate diagnosis relies on two key components. During the physical examination, doctors assess several critical factors, from the specifics of your symptoms to any abdominal tenderness, particularly focusing on Murphy's sign and potential jaundice. Alongside this, crucial blood work helps complete the picture. The liver function tests can reveal elevated enzymes or bilirubin levels indicating blockage, while a complete blood count showing elevated white blood cells may point to inflammation or infection. These diagnostic tools work together to help pinpoint the underlying condition. 3 powerful imaging tests help confirm gallbladder conditions. Abdominal ultrasound serves as our first-line test, employing sound waves to detect gallstones and inflammation. When more detailed examination is needed, we utilize CT scanning to evaluate potential complications. Finally, HIDA scans help us assess gallbladder function by tracking radioactive tracers through the bile ducts, revealing any blockages in the system. The initial treatment phase focuses on stabilizing the patient's condition through 3 key interventions. We start with IV fluids to restore hydration, especially important after episodes of nausea and vomiting. Pain management is equally crucial. We use analgesics like NSAIDs and opioids to help the body rest and recover. Finally, if there are signs of bacterial infection, indicated by fever and elevated white blood cell counts, we prescribe targeted antibiotics to prevent the infection from worsening or spreading. Sometimes medical management isn't enough, and we need to turn to surgery. The gold standard is laparoscopic cholecystectomy, a minimally invasive approach using tiny incisions and specialized instruments. This technique offers smaller scars, shorter hospital stays, faster recovery, and less post-operative pain. While traditional open surgery may still be needed for complex cases, the laparoscopic method has improved patient outcomes dramatically. Let me walk you through what to expect during recovery. For laparoscopic procedures, most patients return home within 1 to 2 days and recover over a few weeks. Open surgery patients typically stay in the hospital up to a week with a longer recovery period. Your recovery plan includes proper pain management with prescribed medications, keeping incision sites clean and dry, and following dietary guidelines, starting with light foods before returning to regular meals. It's important to ease back into activity with gentle walking while avoiding heavy lifting. Throughout your recovery, stay alert for potential complications like infection, bleeding, bile leaks, or post-cholecystectomy syndrome. Remember, if you notice anything unusual, don't hesitate to contact your surgical team. Want to prevent future gallbladder issues? Let's talk about some proactive lifestyle changes. The 2 key areas we'll address are lifestyle modifications and regular health monitoring. For your diet, emphasize fiber-rich foods like fruits and vegetables, choose healthy fats like olive oil, and maintain consistent meal times. Weight management is equally important. Aim for regular exercise and steady, healthy weight control rather than rapid loss. Just as crucial is staying on top of your regular checkups and working closely with your healthcare team to manage any underlying conditions like diabetes. These preventive steps can make a real difference in your long-term gallbladder health. Here's the encouraging news about acute cholecystitis. While it's a serious medical condition, it's highly manageable with the right approach. Success depends on understanding its causes, recognizing symptoms early, and getting prompt medical attention. By combining lifestyle changes, accurate diagnosis, and appropriate medical or surgical interventions, patients can effectively manage this condition. Before we wrap up, I need to emphasize these key medical disclaimers. This information is purely educational and not a substitute for professional medical advice. Please consult your physician for any medical conditions or treatments. For emergencies, contact your doctor or emergency services right away. Remember, viewing this content doesn't create a doctor-patient relationship. Any questions?